be presenting on functional structure correlation of retinal ganglion cells. So the aim is this is an observational study where we are trying to understand the topographic correlation between the retinal ganglionic cells to retinal nerve fiber layer at the disc with the help of the OCTs. The thickness values of ganglionic cells and calculating at the circle using the various. So what is the role of OCT in advanced cases of glaucoma, established cases of glaucoma, and in glaucoma suspects? So that will be the basis of the study. Basically, what's in the first we should understand how exactly the nerve fiber layers actually pass through into the optic disc. The papillomacular bundle, they take the central part. This is the temporal. For example, this is the right eye, where the papillomacular bundle enters the center, and the macula, these are the macular fibers, and these two are for the peripheral fibers that enter the optic disc, and these three are the nasal fibers. So basis on these findings, what we understand is whenever you have a thickness of around the optic disc, the nerve fiber layer thickness, it falls into the red zone only when the thickness falls to 80 microns in the inferior and superior quadrants, while in the temporal and the nasal part, you can see in these areas the red starts only at the thickness falls below 45 microns, and the redness and the papillomacular bundle falls into redness only if it falls less than 30 microns. So on this basis, if you actually see various, and this is the picture of the ganglionic cell at the macular area, which is called the GCC. So GCC corresponds to the visual 10 degrees visual field. In that visual field, if you take the various thickness, you can see the red falls, the redness starts around 65 microns, and it falls up to about 40 microns. So even by the time this the GCC falls from 60 microns, the patient might not develop scotomas in the visual field. For example, if you take these slides here, you can see these are two patients here where the sectorial GCC thickness has fallen down to 47 and 46, and the patient has complete absolute scotomas. And you can see when the thickness is about 72, the patient does not develop much of a scotoma, while the patient has, and this is the papillomacular bundle. So in this patient, if you look at the visual fields and the GCC, the papillomacular bundle, even the thickness has fallen down to 40 microns, still the patient has some amount of visual field. But when it falls to 48 and the superior and inferior halves, you can see there are absolute scotomas. When you look at these two pictures here, the scotoma that the visual field the patient has looks very similar. Okay. So what we see in these patients are both the patients have a similar scotoma in both the eyes. But when you actually look at the GCC, the papillomacular bundle is severely affected in this eye, where the thickness has fallen down to 56, and if there is any fall further because of glaucoma, the patient is going to end up to have an complete absolute scotomas. While here, though the visual field is lesser than this, the patient is much more resistant in developing defect in the GCC. So what is very important, even though visual fields show you large scotoma, the very similar scotomas, unless you don't do GCC, you cannot tell what the patient exactly has. So how severe the thinness has gone to. So if you look at these patients here, the scotomas look very similar, and the scotomas have fallen down to, the thickness has fallen down to 55, and is the patient, even in the inferiorly, when the thickness is around 55, the patient still has a good vision. The same patient, if you look at the scotoma here, the patient has 90, and then he does not have any scotoma here. So in these patients, though the visual field look very similar, these patients you have to be more aggressive, while compared to the patients where the GCC is much better. So in these patients, what we proposed a name called perimetric glaucoma in the superior half. So these are some of the examples where the patient has developed almost kind of absolute scotomas, inferiorly there is a loss, and superior field is completely lost, and the patient is very much resistant. I mean, are much more safer in the superior half. In the similar way, the patients, the loss in these patients is very severe. You can see the GCC losses very severe in these patients. Yes, yes. So what is very important is, even the patients have very severe disease. It is very important to also do GCC in every patient of glaucoma to evaluate the scotoma, whether the scotomas are deep or superficial. Even if there is severe retinal fiber loss, sometimes it may not be appreciated on the visual fields. So GCC can help us in evaluating a glaucoma case. Thank you.